Executives India holding their hand together to conduct a series of webinars to enlighten the nurses about the Nurses Day theme, and along with that, what are the other topics, other situations. So I thank actually the Micro Lab and AHPI for holding the hand of ANEI and then to join us together to enlighten this nursing fraternity. Today's topic is Novice Nurse, how can we mitigate fear? Very apt, as the Nurses Day theme is our nurses, our future. And we know that our nurses, the future nurses, are the novice nurses. Ms. Vincy Tribhuvan will be talking about this topic, that novice nurse, how can we mitigate fear? Vincy, a graduate nurse, having a master in business administration degree, and she is a PhD scholar in healthcare management. Our outcome-oriented professional with exemplary leadership skill, she never compromises her attitude towards team building and customer focus. With a vast 29 years of experience in nursing practice, administration, and quality, she exhibits her passion in nursing empowerment, competency, and capacity building. She is a Lean Six Sigma Green Belt holder and skilled at conceptualizing and implementing continuous quality improvement. She currently decorates the post of Secretary, National Secretary, Association of Nurse Executives India, and we are proud of you, part of ANEI. We are proud of you, Vincy. And she is an active member of Health and Environment Leadership Platform. She also, as an assessor, she works for quality and accredited institutions, Green Hospital Standards. And she has won national level award in Jobs for Us Women in Healthcare category, and proudly says that she is the first nurse to get it. With her vast experience, she is a resource person in nursing field, and she has participated and presented various national and international projects. We are very happy to have you, Vincy, here. Let us hear that how can we mitigate fear of our novice nurses. Wholeheartedly, I welcome you, Vincy.
Thank you so much. Thank you so much, Dr. Ajee. And a very good afternoon to all of you present here. And thank you so much, AHPI, Micro Labs, and my dear very own ANEI. Thank you so much. Word format. So I can't share full screen. No? Share. Slide share. No? Just wait a minute.
We are able to see your screen.
Okay. Thank you so much. Thank you. So today's topic, very much needed, very much close to the hearts of all of us here. Nurses are the backbone of a hospital system and play a critical role in patient care. They are the lifeline of hospitals, right? A nurse wears various hats in a single day and solely responsible for making patient comfortable and ensuring the right to medical care, and medical care is provided on the ground level. They are the faces the patients and relatives see on a daily basis, whom our external stakeholders can interact, and they are the main contribution towards the day-to-day medical operations on the ground. With so many responsibilities, can you imagine what would happen if these lifeline carers are not well trained and taken care? What could be the consequences? India ranks the highest in producing nurses. Around 3 lakh nurses graduate every year with heart full of dreams and venture into the vast and challenging world of healthcare. Newly graduate nurses have the basic academic and practical skills required for entering to work as qualified practitioners. However, they have not been able to fully integrate their theoretical knowledge with clinical practice. They very often experience an extensive range of emotions while at work, while newly they have joined work, such as anxiety, fear, depression, emotional exhaustion, helplessness, hopelessness, feeling immense time pressure, and despair. With these worries and sense of lack of control over their environment comes a substantial need for the emotional support. Without an appropriate source of support, these problems may compel them to leave their profession. Emotional intelligence plays an important part here. It's a factor.
Excuse me, Vincy, sorry to disturb you.
Yeah.
Are you moving the slide?
No, I'm not moving.
You are with the first slide where the
Yeah,
noise is
So
the
it's
heading, right?
No, I'm not moving. I'm not.
Okay, thank you, thank you.
So emotional intelligence is an important factor for nursing students' success, their work performance, and retention. It can allow them to face challenges in clinical placements effectively, improve their interactive skills, perform better in practice, and engage, of course, enhance patient safety. Although this emotional intelligence and maturity increases with the age and professional experience, it is of utmost importance for all of us to take care of the novice nurse in a very holistic manner. So why do we have to focus? Now, I have given some hints. Now, still, what is so important about them? India currently has 1.7 nurses per 1,000 people. The World WHO recommends 3 per 1,000. We approximately produce 2 lakh nurses every year, but 40 to 50% leave the country within 2 years of graduation. One study found that a staggering 33% of new nurses leave their job within the first year, and up to 56% leave within the second year. They are the group easily burned because of the job strain, lower job satisfaction, lower affective commitment, and higher resigned attitudes because they lack the technical and communication skills. And of course, at the starting, they have got low confidence and professional decorum. So when a new nurse is graduated and she comes with a lot of commitment to herself, to her family, and to even she wants to be dedicated, hardworking, and committed to her patients and the organization. But what happens in the first 3 months? Because first 3 months are very important for her. Excuse me. What are their fears and concerns? There are a range of emotions a nurse go through, a new nurse go through. We all have gone through that. But some are stated here. The fear of the unknown, because now we all know that I'm coming to that point in the next slide. Our basic nursing education, how it is meted out. It has become a robust business now. costing each nurse, is a BSc nurse sells out to 2 lakh rupees per year. At least 10 lakh rupees she has spent. At times she has taken loan. At times with extremely financial pressure she has completed. And our hospitals, our nursing colleges do not have mostly parental hospital. And why are we questioning it? Because she has not been shown a real patient and real-time emergencies and disaster. So for her, venturing into a hospital is fear of unknown, what I am going to expect. And she's looking, first time she's looking at blood and body fluids. Maybe not first time, but she has not been exposed. That's what today's scenario in nursing colleges are. I have seen many of my known people and students telling, we have a hospital, the nursing college, of course, they advertise, we have our parental hospital, but who are the patient? And the students are the patient when they get sick. Even now, if they are sick, they are sent to some outside facility. That is the scenario of star nursing colleges in some metro cities. So she is coming to the fear with fear of unknown, and she continuously acceptance from everyone. She continuously seeks acceptance from her colleagues, from doctors, from patients, from relatives, of course, from the in charge whom she is looking up to, and from nursing leadership. And with all burden, she has got extremely low level of confidence. And she, of course, as I explained, she lacks the bedside knowledge, bedside care, bedside procedures. That itself gives, she's petrified because of that. And fear of being misunderstood. Because not all of this, hardly 10 or 20% of our nurses speak so strongly in front of a consultant. That is because of their basic attribute of within themselves, what they have, that assertiveness. It is not the nursing college or someone else has taught to them. 80% of their nurses are very scared to escalate problem, to speak out, and to come forward. So fear of being misunderstood, even if they are right, they won't express it because of the fear of being misunderstood. And anxiety of being punished, because however in public platforms and other forums, we all chilla ke baat karte hain. No, we have to be non-punitive, we have to be system oriented, not person oriented. Sadly, it is not the same at the root cause, at the root level. So anxiety of being punished, and of course the most fearing factor for her is being causing harm to her patient. That prevents her going full blown to the bedside. That puts a limitation to her. And what is the facts and reality we provide to her? Many hospitals have inadequate onboarding and mentorship. Onboarding, I mean induction, orientation, and the other procedures which follows that. With high attrition and increased demand and workload, nurse leaders are under the pressure that the moment someone is joining, within 3 days, even on the same day, give her some patient, let her take vital signs, let her check the sugar. So inadequate onboarding and mentorship, she is facing the first thing. I myself has experience on my first day in a hospital where I would not want to take a name, in Mumbai hospital. I was told in my first day to shift a patient to operation theatre. I did not know the ABCD of even that. Where is operation theatre? Shifting a patient to operation theatre is a very, very critical procedure. And when I asked that person who gave that order to me so many years back, she told me, I have done the same on the first day, so will you do. Nobody has taught me the same, and you will do the same. Immediate patient assignment and supportive seniors. Here, the main person who comes here is her direct in charges. Leave alone the colleagues, leave alone the nursing leadership on the top. Her immediate in charge plays an extremely important role in making a novice nurse comfortable. High expectation. She has not cared for even one patient. And we start with 3 patients. Stable, de do usko. And ICU, give her a non-ventilated patient. And we are setting high expectation, which puts her under tremendous pressure, intense workload. With accreditation and advanced technology, we have too much of forms and formats. which makes them spend less time at bedside, even though it is required. If you do a time and motion study, if you analyze each and every movement of your nurse, she spends in 8 hours at least 5 to 6 hours in administrative work. Hardly 2 hours she spends at her patient's bedside. Minimal comfort. How many of us have really gone and asked our nurse whether she had at least one tea in 8 hours? They leave 6 a.m. the nursing hostels, most of the hospitals, for morning shift. 6 a.m. they don't feel like eating. At times we provide, many hospitals I know provide breakfast around 10 a.m. But does she has the time? Someone comes and tells her, I will look after your work, go and have breakfast. Not always happening. The comforts are very much minimal. Anytime we have observed or noticed the chairs in the nurses station always occupied by non-nursing personnel, and the nurse always stands 8.5 hours, 8 hours, she stands on her foot without the minimal comfort. And of course, we are still into our punitive system. There is rarely some of the leaders who stand up and who are against the punitive system. So these are the factors starting with, and some more and many more. The nurse comes with a lot of expectations and her intentions are really truly great, but this is what she's meted out. So the focus group. So where the problem lies, I would be wanting to touch only what is relevant, what is practical today. I would not want to dwell into what system can do for us, what policy makers can do for us, how I want it should be in the future. Rather, let us focus today, how I am going to make a difference to my nurse today itself, starting from today evening. Because this does not need this very practical point which we are going to discuss, including the novice nurse herself, what she has to do, does not require additional resources, does not require some great support from management. So let us look at the focus points. There are four department or people or factors which is directly attributed in taking away the fears of a novice nurse. Of course, starting with our nursing curriculum and faculties, the organizations she's joining, that are the policies, and the nursing leadership, and at last, but the most important person, she herself, the novice nurse. So these are some of the cutout, I have taken in the nursing curriculum and faculties, especially how many new colleges would solve India's nursing. The most recent news that we are going to have many more nursing colleges. But we all have to question ourselves. Is it lack of nursing colleges are really a problem? Or the problem lies with our education system, nursing education system? How many hospitals have been really audited and looked into whether the nurses there have been really exposed to bedside care? Some of the students who are really into second year and third year of the BSc nursing, who are taken to other hospitals for clinical exposure, are just helping out in OPDs, just filling in some basic work there. There is no exposure. Just they put them on a bus, take them outside and bring them back. So is nursing colleges deficit is a problem, or our nursing education system and the faculties and the way it has been conducted is the problem here? There are more than 850 nursing colleges in India that trains students to become professionals. But quality of education, real-time experiences, and the efficiency of the faculties are highly questionable. The nursing education needs an upgradation, starting from the selection of right candidate. We have got various methods we have not standardized our entrance exams. Each one has their own. There is NEET, their private colleges follow something, deemed universities follow something else. So the even selection of the candidate who is appropriate, who has inclination towards and who has the basic skills of science is coming to nursing profession. So starting from the selecting right candidate, providing a positive and stimulating learning environment, and faculties who are well versed with both in clinical as well as sound academical knowledge with exposure to advanced teaching methods are required. The one who doesn't have experience in hospital settings, just she did an MSc, so she doesn't want to be a clinical nurse. She wants directly go to a tutoring and academical side. When she herself has not seen a patient, she does not know what happens at the hospital side. How can she train students? That is something really we need to look at too. The one who doesn't have experience in hospital setting, who have less experience in handling a real patient, is not so effective in providing knowledge and guide the students appropriately. Thus, maybe a dual role who has got some basic knowledge, maybe few years, mandatory spent at bedside, with great academical knowledge will be far better in training the students. It will help them to mold them into a better nurse with good understanding of latest technologies and real-time patient emergencies and disaster. Maybe once the student completes, I don't know how many colleges do have now that, or whether we really having, but a transition program where the nursing colleges in very much effective collaboration with hospital, if they built up something, and if both together, main 80% part from the nursing colleges, handhold them and induct them slowly. And those people have to be responsible for the growth and integration of the system, of the staff nurses into the system slowly, which is highly needed. And it might help the nurses to deal with their professional and psychological challenges. Then comes our main point here. This should take care most of the problems. But at times our hospitals has all the policies, but we are not practicing it because of our increased workload and lack of nurses. So we are under the tremendous pressure. So each hospital has to have a documented, structured onboarding. Let each and everyone go through an HR induction first, at least for 3 days. Let them understand our organization. Let them take a physical orientation and look at the specialties, some important key stakeholders, decision makers. Let them meet them in person. Let that fear of being in the unknown slowly wear away. And there should be robust induction and orientation. Minimum 1 week, if not 10 days, extensively for 20 days, 15 days. At times, lengthening the period is not effective, even though it is 7 days. How effectively you are going to induct and orient the nurse is more important. And mentorship. Once she finishes her induction, do we believe in giving a buddy for her who is well versed in the system? Or directly we are assigning her the patients? Individualized open house. What happens in individualized open houses? Why I don't write only open house? Because many hospitals are having this open house system. But what they do, they call all the new joinees once in a month or once in 3 months or once in 2 months and start asking questions. How comfortable are you? This is okay, this is okay, this is okay. And my dear, no one gives the right answer. What is in her heart? What she is going through? No one is willing to answer there. Some answers you might get. And we have another very bad method or system of, if I hear something from someone, which word are you? Then I directly go and complain or tell it, I think that I am doing a corrective measure. I go and report to that in charge. But what happens there? The girl is in more trouble than she is being helped. That is why it is individualized to open houses to be practiced. One-on-one meeting with the in charges and nursing leadership. Encourage her to tell her all her whatever she's been going through, maybe positive. Why we should think all negative? Maybe she has got something positive to tell. And if at all she comes out with her some kind of challenges, absorb everything. As an in charge, as a leader, absorb. Take a note of everything. And without particularly targeting an in charge or some, in a structured method, change the way you look at things and your in charges look at things. Go in a systematic way than personal methods. Maybe your in charge needs some kind of hand holding. And then we come to competency privileges. How many of our nurses are really assessed truly for competency and privilege? It has just become a document where put met and unmet. Some portions are left for future training. So we put everything as met, just for filling our document. The nurse is under tremendous pressure because she's been met and she has been signed off. She has to perform. She cannot afford to make mistakes. So these policies need to be very strong in a system and need to be audited. The organization, the non-nursing personnel might not be interested in this except for accreditations when external audits happen between department and hospitals. So who is responsible for that? Then we are coming to the most important people and person in mitigating a novice's fears. The nursing leadership has to have multiple check mechanism whether the policy which he has made and is in place is adhered or not. She has to do frequent rounds, frequent audits, surprise audits. Because once you forget to go to the ground, your in charge takes it easily. She comes under the confidence. Oh, no one is bothering me. No one is questioning me. How many of us really going and checking her open house records? Her anecdotes. Anecdote should not be perceived as something negative. The book or the document. How many of us really has checked as leaders? The buddy program, the mentor-mentee program has been really done, has been really followed. Some people call it a shadow. What shadow means? A new nurse, a new novice nurse has to follow us an expert nurse, an experienced nurse, at least till she gets comfortable. Whether the duties are aligned, whether naam ke vaste isko buddy bola hai, whether she is really following an expert nurse, whether during competency and privileging, is she really made to do the procedures or it is tick off? So once the leadership takes it easily, your in charge comes and lot of confidence and comfort zone. And once in 6 months you go, maybe before your accreditation you go, and then you will have all the charts filled overnight or 2 days prior. Facilitate skill enhancement trainings and workshop. Maybe some things are advanced technology for expert nurses. But most of your programs, depending on number of new nurses joining you, your program should target her skill enhancement, which has not been shaped at your nursing college. Meet the new joiners at the induction, and at least once in a month in the beginning for 3 months. Have a record of it. It will help you to further plan your training planners when you speak to individuals. And how many of us put a new nurse at ease? How many of us without appointment encourage nurses to come to you and talk to you? How many of our leaders are really visible in the corridors? Very questionable. And how many of us really like being met by a new nurse and maybe some pleasantries exchanged in the corridors? Why do we always want to wear that crown and walk an unapproached figure like? Times have changed. You are dealing with generations in a new way. They expect democratic leadership. And of course, we should be assertive and we should be conditional where it is required. But we don't have to be all the time. Give the confidence to the new nurse that someone is there. Even my in charge doesn't treat me, and which happens at most of the time. New nurses are bombarded with difficult patients because you rely on your in charges and your in charge rely on her team leaders. What happens after 5 p.m. when all the top level people have gone home after 7 p.m.? Most of your patient problems, your feedbacks, and harassment to new nurses happen at that time. When an in charge leaves, patient assignment for night shift and evening shift to a team leader, problems are there. There are frequent problems, frequent innumerable feedbacks. When a new nurse does not want to stay after 6 months, one of the main reasons is being given all the time difficult to patients, ventilated patients, whereas some privileges are given to other nurses whom they favor. So as nursing leadership, we are the one who are going to give the ultimate confidence to the new nurses. Counseling sessions and resilience program. Many of our new nurses comes under tremendous pressure, not just because of workload. At times, who knows, they might be having personal issues. There's a lot going on in their life. When you look at a sad face, when you look at a withdrawn face, don't just pass on. Talk to her. Spend 2 minutes with her. Ask her, how can I help you? You are not comfortable. Please do come to my room. Give her a time slot. Encourage her to come to you. Encourage her to speak frankly. Communication solves most of the problem. And encouraging to communicate is a blessing. Appreciate the good deeds. How many of nursing leadership are truly has developed and having a robust nursing appreciation forum? We just rely on HR. At times we say, HR don't do this, HR doesn't do this, we do not have any appreciation program. But how many of us really have gone into that, let me make something for my nurse? So in our hospital, we have got spot appreciation. Each floor of my hospitals have at least 250 to 300 cards, thank you cards are given to my nurses by consultant, patients, relatives, colleagues, maybe even your own in charge, maybe nursing leadership. Whenever a nurse does a good deed, whenever she's been praised by a consultant, by a patient, by a relative, just immediately sign a thank you card, give to her in front of others. And we have, most of us have this habit of scolding, threatening, shouting our new nurses and other nurses also in front of others. Some nursing leadership believes that when they go for round, if they don't make some noise, they are not respected. Extremely wrong here. We have heard some people giving feedback that when so-and-so leader comes, she makes some noise. When your nurses is bullied, nurses are bullied and bring down by other various stakeholders, you do also the same in front of others. It doesn't go well with them. So at least appreciate in front of others for the good deeds they are doing. And you need to be strict with them. You need to counsel them on some negative things. Do it alone. Do it when they are alone. It is more effective than being scolded in front of everybody. And cultivate in them the seeds of hope by showcasing a nurse's success stories. There are various institutions who believes in internal promotions. They do not take any leadership roles or maybe in charge level role. Maybe all the positions are filled in-house. And you may have a lot of success stories. Maybe a staff nurse who has grown in the same hospital has become, yes, chief nursing officer. There are various stories. Show that success stories to your new nurses. maybe in induction, maybe in between. Let them know, oh, being in this hospital or doing my best will take me somewhere up higher here. And value the dignity of individual and stand up for your nurses. You know what, sometimes I wouldn't say nursing leadership, but we have got many spineless in charges. In charges again and again. I'm coming because she's the first point of contact and she plays a great role in dealing with novice nurses. When a difficult consultant comes for round. When a difficult scenario happens, she slowly goes away from the situation. Don't know where she goes. Maybe having tea, maybe somewhere, and she let the novice nurse or the new nurse or any senior nurse face the music. How would you want your nurse to respect you if you are that kind of a leader? So value the dignity and stand up for your nurses when she is being pulled down unnecessarily, mercilessly. Maybe with her mistake or without her mistake. Mistakes can be corrected. And advocate for non-punitive system, for which, first of all, the nursing leadership should believe in non-punitive system. Start looking at things in a systematic way than person-oriented. So non-punitive system will encourage your nurses to come and report, to escalate and express the problems to you. When they are bombarded with incident reports, one hospital has explanation letter for everything. They might have got lots of explanation letter from nurses. And very sorry to tell, it is taken only from nurses. Other departments make mistakes, no letter is taken. Why the nursing leadership allows this kind of system? Why there should be an explanation letter when an incident report is raised? So the staff is under constant pressure that written letter is taken from me. It is kept in my record. So, dear nursing leadership present here, let us advocate for non-punitive system. Encourage and facilitate for higher education. This is part of showing a success story to them. When a new nurse feels, oh, I am a BSc, maybe in 2 years I would want to do MSc, talk to her, tell her, be with me for 2 years. I will facilitate. I will speak for you to the management. You can do in service your higher education. Show them the success stories of whoever has already completed. For which we do not have to sign bond or take their certificates. System works well even without that. So please do encourage for higher education. That plays an important factor. If for preparing for OET, some girl is leaving you, some new nurse, especially new nurses go. 6 months prior before going to abroad, they go for OET preparation. Tell her, I'll give you a comfortable duty. All the time we won't be able to encourage or support them, but do the maximum. Let us believe in providing the maximum to them. And keep a formal succession plan for internal promotions. Show them that to you that how many nurses has been promoted from staff nurse to team leader in your organization, team leader to in charge to ANS and ANS to CNS. That gives tremendous hope and confidence to be in that system for the new nurse. We can go on and on how a leadership plays an important critical role in hand-holding the new nurse, in supervising, in monitoring them. But at least let us follow what is being told in simple terms here. And tips for the novice nurses here. You know, as yesterday, Captain Usha Banerjee and Captain Ajita explained, the nurses always are into the victim mentality. We think a lot of unfairness is meted out to you. Everyone shouts at us. Many times we are not able to open up. I think respect is earned. First, you have to stand up for yourself. So just novice, new nurses, who are listening, just these are the tips which can enhance your personality, which can enhance your presence wherever you are working. At times we are feeling, once you reach the higher position only you become a star. But I believe even being a staff nurse, you make few strategical changes to your personality and the way you communicate and the way you stand up for your patient. You are a star among your colleagues. So be warm-hearted. Wish your seniors. Do not come under the pressure. Oh, I keep wishing all the time, but she never wishes back. I strongly believe you should have your own standards and do not bring down your standard as per the standards of someone else. Because someone has not wished you back, don't stop wishing people. Wish your colleagues. Be smiling. Wish your consultant, your patients, your relative. Get to know the people and environment around you slowly and quickly. How when you get a mobile, how deeply you go into looking at all the function, and how we all are very versatile with all those advanced technology programs which are coming online. So is it so difficult to get to know your hospital and its important people? It's on you. Briefly introduce yourself before any interaction with any stakeholders. You need to make a lot of telephonical conversations, communications, personal communication in your 8-hour shift. Always introduce yourself. Don't expect others to know you. Believe in communication and express yourself. Communication is one of the strong points which will make you stand out. Communicate positively, communicate effectively, and try to express yourself. Whenever you are undergoing some difficulties, pay attention to the trainings and imbibe what is taught to you well. Carry a small notebook to prioritize your work. At times, after night duty, you are given calls that you have forgotten some task. Many times we get carried away. We are in life and death situation in a hospital. So everything doesn't register. You are being pulled from so many sides. So why not carry something to prioritize your work? Why not write down something in red ink which is important to you, which you need to remember later? Keep alarms for reminders for incomplete tasks. We frequently get feedbacks that IV was started, but nurse had not come for 30 minutes, for 1 hour. It has gone out. I rang the bell. Nobody came. Why not keep an alarm 15 minutes if you have started a 100 ml bottle, you know it will get over in half an hour, maybe 1 hour. Why not keep an alarm 15 minutes or a reminder somewhere, whichever is convenient for you, to go and check that patient? Out of your 6 or 8 patients, not all of them have it. Maybe half of them have. Be serious about handovers. What is taught to you how to take handover? Briefly at bedside, with file, with both the nurses being present. Do we do it? Or do we catch up some comfortable corner and just go through few papers? How many of you come and greet your patient and tell them, sir, I am going to look after you in this shift. My name is so and so. Please do ask for me when you need any work, when you need anything to be done. How many of us do? And the most important one, seek help when required. You are in a complex world. Even though it's 8 hours, it's a complex world. And you are dealing with other people's complex situation. And you might come under a lot of pressure. So please speak out and seek help when it is required. Do not delay it until you get burned out. Keep an open mind for learning and be a continuous learner. Believe in yourself. Keep open-minded. Do not shy away from in-house trainings. Oh, 8 घंटा मुझे रुकना पड़ेगा. After duty, I should do all that. It is being done for your betterment, your professional development, your skill enhancement. So keep an open mind for learning and never think, I have got 10 years experience, I have got 1 year experience, and I have come from NABH accredited hospital, I know everything. When you think in this way, the block is done. Then you are not open for learning. You are not open for any new initiative, the change management, nothing. You are not going to accept anything. And for everything, you will have a no say. So adapt to yes culture and keep open mind for learnings. Be empathetic to your patients. This has been told time and again. Put yourself in patient's shoes, in patient's relative's place. What if it was my father? What if it was my mother? What if it is me myself? I would want the best. Do the best for them. Advocate for them. Try to be a team player. When you are new, you all are in a team. You to seek help when required. At the same time, you might be smart in finishing work. Someone else is struggling. Maybe she's not as quick-witted as you. She's struggling with her documentation. You have completed your duty. Go ask her, can I help you? Be a team player. Let your team, when 4 or 5 people are put in a group together, when they see your name in the ledger along with them, let them be happy. Let them feel that euphoric feeling, oh, so-and-so is working with us. So this is going to be great fun. And we will accomplish our task in time and all of us will live together. Maybe tomorrow when you are in difficult situation, others will come to help you. Don't fear to report errors and delays. Most of our incidences and other problems, consultants getting upset happens because things are not reported on time. Things have been delayed. Your leadership is put into tight spot because it was delayed and it was not reported. So please speak and please escalate things on timely manner. Build confidence slowly around the doctors and others. How many of us really get to know, I am looking after 6 patients. Do I know who are the doctors concerned with my patient? Primary consultant. When he comes and stands in the nursing counter, do I recognize him? So do I make an effort to ask my seniors, who is this doctor? Kindly show me, kindly introduce me when he comes. And how many times proactively you go to him and tell, sir, I am looking after your patient. I'll come rounds with you. Immediately the change happens in the other side. Maybe tomorrow onwards he will look for you. Where is she? Escalate unsolved matters to your seniors on time. So repeat again, escalate unsolved matters on time to your seniors and immediate in charges. And at last, golden rule, document everything you have done your shift. Document, document, and document everything. That is the only thing which is going to save you in-house and when problems happens from external forces and other places. So that's all today from me. So my dear nurses, I'll end with this. Forgive yourself. You are not perfect. Show yourself grace. You are still learning. Hold on to your patience. You are on a great journey and you would be a success story one day. Thank you so much for giving me this opportunity and hearing me so patiently. Thank you so much.
Thank you, Vincy, for such wonderful and elaborative session. You touched the present scenario in a apt way, and there was nothing theoretical. It was all practical and daily what we are facing. It was a wonderful talk. I have 2 queries in this chat box. One person has not put the name, said that when she was a novice nurse, she also faced the same problems. And her question is, when a new nurse is in upcoming years not showing much interest for learning, they are just coming to the hospital for experience to go abroad. So why it is happening?
I feel, today's scenario, many male nurses and females from even good backgrounds are coming, choosing nursing profession with only intention of going abroad. Okay. So and as I said here, many hospitals do provide certificates even without much attending the college. And we have got one new batches coming out, COVID batch. I don't think any of them have truly been in college and seen patients there. Believe me, when one of, I wouldn't say which department, one of the medical person was asked after recruitment, where do you put the Riles tube? An atrocious answer was given is in the uterus. That is the level of education has gone down. So even though she comes with an attitude of going to abroad 1 year, what she feels, in abroad there are no patients? How she is going to deal with that? And it is very individualistic. What is your conscience says? Nobody, see, people can teach you and touch the subject in some manners in these kind of forums and maybe at individual. But after all those things, nursing and medical professions are very noble and very conscious oriented. It is your inner conscious. You are here to earn money, or you are here serving and earn money. We all want to earn money. But it is not just earning money and settling well. So what your conscience says? Am I being truthful to the nursing what I am taking? So I guess it is very individualistic, and all of us have to learn their own, they have to learn their challenges and go through that. We cannot go and tell somebody who has the mindset. There are other opportunities and jobs are available if you have to go abroad. But don't choose nursing profession if you are not really wanting to be at patient's bedside and care. You can choose some other profession if you are really interested in going abroad just to earn money. That would be my answer.
Thank you, Vincy. Another person says that she's a working fresher, and as the salary in India is very low, what is her suggestion is that and where people are working very hard, but the salary is very low. So what she says that let them go to other countries where salary is high than working hard in this country. What's her take on that?
So nobody's preventing them. Even now, 50% of our nurses, I think last year, 50% of our trained nurses who came out of the colleges have gone abroad. So nobody's, you go and new nurses are coming. And are we going to stop because someone is asking you not to go? No. So we all have our priorities set. But just I would want one thing to be reinforced here is just spend at least 1 to 2 years in the organization which has given you hope, which has handheld you, which has made you a person you are today. So at least assure them 2 years you will be there. If you are blessed enough to be with the good nursing leadership, good organization which cares for you, of course, India has a different pay scale, which cannot be compared with abroad countries. That is there. Let the policymakers take care of it. But you as an individual, you are most welcome to go. But at least give 1 to 2 years of assurance to the organization you are joining just after your education, because they have played a major role in shaping up your skills.
Yes, our topic is how to mitigate the fear of a novice nurse. We are not here to debate the salary part of a nurse, because it's an ongoing debate. Yeah. Neither Vincy or AHPI or ANEI or we can, on this platform, we cannot take a decision. So I think the next question is also answered to this. Our problem is the novice nurses, when they enter into a full-time service, they are anxious, they are worried how they can work confidently, how they can face the physician, face the patient's relative confidently and communicate effectively. That is what Ms. Vincy was telling. Vincy, I have a query that we have lots of resilience programs. Do you think this resilience program will help in mitigating their fear?
See, at times, sometimes the institution wakes up and all of rest of so many institution is going, let me also conduct resilience program. And many times we go, and it is not it is not consistent. I guess because there is one hospital which I know, what they have done is they have created a resilience program, and also the individual that the program manager, her number is rotated, populated among the nurses, and things are confidential, and the nurse can call or anyone in the organization contact that person and seek help for free. Okay. Internal strength plays an important role in shaping up an individual towards mitigating these fears. But running this resilience program and keeping the consistency of it and confidentiality, and not to have a stigma kind of thing towards that nurse. Even nursing leadership should not know. If you are running a resilience program, the nurses who has seek the help, or who are still seeking help, who are in contact with the program manager, even the nurse leadership should not know who is it and what is the details, because then what we know, we our mind creates a bias towards that person. In case maybe even naturally, if she has done a medication error, we attribute all her problems to that medication error. Oh, उसका तो जिंदगी में ऐसे चल रहा है ना, इसलिए उसको ऐसा हो गया. Even nursing leadership is a human being, and human mind works like that, right? So of course, running the resilience program, keeping the consistency of it, and maybe frequent updates, taking feedbacks from the program manager with the complete confidentiality, without closing the information of individual and detail, definitely will help, if not completely enhance a person's personality.
Thank you, Vincy. One more thing I want to tell you, in agreement and some part disagreement with the statement. Like we said that yes, the nursing tutors coming to the hospital, to the college, most of them, they come soon after a BSc nursing program, where they must not have had a proper training at all, must not have had a proper, clinical area. And then they immediately come to the college and say that, I mean, how are they going to train the students? It's a very important question. It's a very matter of concern, and it happens. And it is at the administration level, at education centers, they need to look into it, because at least a BSc nurse with 1 year of experience should be only taken as a tutor or a lecturer to a college. Second is, many such students, how many such students are becoming a nurse? If it is coming under a university, a particular university, a government level, then, or a health science university, in a particular college, they must be teaching and they must be training in that way. But when they write exams, when they attempt practical, they are coming under a wide spectrum of investigators or invigilators, and still they are passing and coming. I yet to understand what is the magic in that. Second is, there is no mandatory rule that only MScs can teach BScs. So it is very important to see that BSc tutors with adequate clinical experience coming to the college, and when they go to the clinical area with the student, whether it is MSc or BSc, when the teachers going into the clinical area, they too have to touch the patient, demonstrate the procedures, then only the student nurse will get the confidence. It is very important, not that on 4 years of training they have, and 4 years plus the first day they will suddenly gain confidence when they come to the clinical area. They have to have confidence from the day one they enter into the, as a novice nurse, into the novice student into the institution, how to face, how to address, how to communicate effectively. When we ask something, when they answer something else, they have to be, instead of shouting at them, they have to be made clear that have the patience to listen, what is the question, and then understand. If they don't understand, they have all, we should give them the freedom to ask the question back that, yes, ma'am, I didn't understand. Can you explain it? And then correct them, so that from the day one itself, the nurse gets the confidence that, yes, she can communicate effectively. That is very important. Effective communication and a good training will remove this fear from a novice nurse. They can be very confident. Thank you, Vincy. Thank you so much. Is there any other query?
One query I just dropped in support pertaining to supporting staffs and etc.
Yeah, the another question is that if anybody any nurse, staff nurse is interested to go abroad as a in charge, and how she will be encouraged supporting one staff. I mean, how the administration will support, the nurse administrators will support the nurses to go abroad.
So it is already been discussed, the administration after a nurse has spent some time with you, she has dedicatedly worked for 2 years or more, maybe 5 years. I have had, support completely been given in all terms. Maybe she needs to do a higher education. Maybe she goes to go for preparation, exams and many things. So as already it is discussed, nursing administration has to show success stories of what was done prior. How many nurses has been really supported? How many of us really have gone from here to here? That pathway has to shown not just for going abroad in all matters, maybe higher studies, maybe various other positions. So that is a nursing leadership role that's discussed already.
Okay.
They require support to be given.
Yeah. Thank you, Vincy. I think we will wind up and hand over the session to Mr. N.K. Raja for his closing address. Thank you so much. Thanks all the participants for their cooperation and listening. Thank you so much. Over to you, Mr. Raja.
So good evening, fellow nurses, and it's been a very nice 1 hour of session from the speaker, Ms. Vincy Tribhuvan. We extremely thank you, ma'am, for sharing your wisdom of thoughts over this topic of today's novice nurse. How can they mitigate their fears? In fact, I just offline comment which I would like to also probably make is that I think brain drain is something that it's part and parcel of our country, and probably every profession is undergoing that kind of a challenge, whether it is nurses or pharmacy or even doctors by themselves. But finally, we have truly examples like today, our Lieutenant Colonel Ajee madam or Vincy madam. They are all true leaders who have stayed with the country and they have served the multiple portfolio, and still you're all been there. I
think we will wind up and hand over the session to Mr. N.K. Raja for his closing address. Thank you so much. Thanks all the participants for their cooperation and listening. Thank you so much. Over to you, Mr. Raja.
So good evening, fellow nurses, and it's been a very nice 1 hour of session from the speaker, Ms. Vincy Tribhuvan. We extremely thank you, ma'am, for sharing your wisdom of thoughts over this topic of today's novice nurse. How can they mitigate their fears? In fact, I just offline comment which I would like to also probably make is that I think brain drain is something that it's part and parcel of our country, and probably every profession is undergoing that kind of a challenge, whether it is nurses or pharmacy or even doctors by themselves. But finally, we have truly examples like today, our Lieutenant Colonel Ajee madam or Vincy madam. They are all true leaders who have stayed with the country and they have served the multiple portfolio, and still you're all been there as examples for